video, we're going to show you how to do sub-Q fluids, which means fluids underneath the skin. Most of the time, this would be for a cat who has potentially kidney malfunction or disease of some type, so you may have to routinely give sub-Q fluids. So I'm going to show you how to do that at home. Now, a few things that to help out is if you are able to put your cat up on something higher up than just the floor or maybe the couch, it gives you a little bit of leverage and it makes it a little easier for the cat to sit still instead of chasing him around the floor or maybe on the bed or something. If you put him up on a countertop or maybe the washing machine with a towel or a blanket, give him a little bit of, give yourself some leverage. So that might help as well. And when you are sent home materials to do sub-Q fluids, what you'll be sent home with is a bag of fluids, which looks like this. This is called a drip set or an administration set. So I'll show you how to put that together, but it'll come with a needle. And it's a pretty big needle, but it'll make the fluid administration go a lot faster. So to put this stuff together, basically this drip set comes with a spike and it will go in the bottom of the bag. Either one of the ports usually doesn't matter on most bags. Hang out for just a second, Patches. So you'll break that off. There's a little port or a plug in there, and you just need to spike that bag with that drip set and slide it all the way in. And you can go ahead and put your needle on the end of the line as well, which is usually just has caps on it. When you get a brand new needle, this little plastic piece will need taken off. Slide that off, put it on here, and this little adapter will screw on together so it holds it on there tight. So now you're able to hang the bag. If you have maybe some like a cabinet that you could hang this on the handle, you might need to use some kind of little hook that you might have at home, just because this bag does need to be higher than the patient. The higher it is, gravity will help it flow better. So you do want it up fairly high, and that way it helps gravity get it into the cat a little faster. So once you have the set on here, it'll start flowing like that. And you want to make sure that you've primed the line, that there's fluid all the way through it. And this is your flow control. All the way up means that it is able to flow freely. To shut it off, you roll this little ball all the way down, and that will shut off the fluid flow. So it's currently off. And what we will do when you are giving fluids underneath the skin, this is Patches. She hopefully won't mind this too much. But what you're going to do is grab the skin. It's called tenting the skin. You're making it into a tent because you're going to put the needle directly underneath the skin. So what we'll do is lift up. We like to give fluids up in the shoulder area because there's a lot more skin up here and there's more room to put fluids. So when you come in here, you basically tent the skin. So you're going to grab just a chunk of skin and pull it straight up. Get your needle ready. But you're going to pull the skin up, and you've made this little tent right here. And it's kind of hard to see because she has long hair, but there's this flap of skin here, this skin that you can go underneath now. So your needle's gonna go basically towards your hand, and you're gonna push it right through into that tent, and you're gonna push it all the way through until you're burying the needle, till it's all the way through. And that initial poke might hurt just a little, but usually once it's in there, they don't mind too much. And then you can turn the flow on by using your little roller ball. So that will turn on. Some cats might react, like she's kind of twitching a little bit. She can feel it because it's a little chilly, so she notices that. Sometimes it helps to start it slower and then open it all the way after a bit so they get more acclimated to it. Now after a little bit, this will swell into a big lump of fluid, which is normal. That's what's normally going to happen. And depending on the amount of fluids that you're instructed to give, usually somewhere between 200 to 300 cc's or milliliters, it is marked here on your bag. So if the fluid level went down to 1, that means you've given 100 mils. Down to 2, you've given 200, and so on and so forth. So if she needed 200 mils of fluids, we would give it until it's down to the 2. And again, just depends on how much your doctor has recommended that your cat gets. And so once that is full, which may take maybe 10 to 15 minutes or so, once that's full, what you'll do is shut it off. Shut off the flow. And then you're going to pinch right where your needle was. You're going to pinch that and pull it out. Definitely put the cap back on right away so nobody gets poked. But then you're going to hold that for, maybe just a few seconds, up to a minute or so, and that will help keep some of the fluid in there. Some may leak out because that's a pretty big needle, and some may leak out, which is fine. It may just drip a little bit, so you might want to make sure your cat's not sitting somewhere that you don't want to get maybe a little bit of that fluid on. But let it sit there for just a minute. When it's done leaking, you'll be all done. They can get a treat and get down.